I understand and consent that the following information will be gathered and utilized for educational purposes by Indiana Wesleyan students. I allow this information gathering and physical assessment to be videotaped and posted on YouTube for access by faculty in Indiana Wesleyan University. The video will be deleted by the student as soon as it has been reviewed and graded. I further acknowledge that this is for educational purposes only and the information is not meant to be diagnostic. Therefore, Indiana Wesleyan University, the faculty and staff, as well as the student, are not considered liable.
Hello, my name is Juliet. I'm going to be your nurse for today. Can you tell me your name?
Thelma Johnson.
Do you know where you are, Miss Johnson?
Yes, ma'am, and I'm at the clinic.
And can you tell me what month we're in?
February.
Okay, I'm here to do a head-to-toe assessment on you. Is that okay?
That's fine.
Okay, first I'm going to look at your skin. I just want to make sure your skin is free from any lesions or sores.
Okay.
And I'm looking at your skin color. It's nice and even. I'm going to check your temperature. We already did your vitals, so we're just going to proceed to the physical assessment.
Okay.
You're nice and warm, and your cap refill is less than 2 seconds. Okay, while I'm here, I'm just going to go ahead and I'm going to palpate your sinuses and tell me if you feel any pressure.
No pressure.
Okay, I'm going to check your lymph nodes. I'm checking for tenderness, any swelling. So tell me if you feel any pain.
No tenderness, no pain.
Okay, while I'm here, let me put some gloves on. I'm going to check your head. And while I'm checking your head, I'll be looking for any lesions, any sores, and I'll be looking at your hair.
Okay.
Okay, I can tell your head is nice and round. Does it feel tender anywhere?
No tenderness.
Okay, no masses noted, and your hair is evenly distributed. Okay, I'm going to go ahead and start checking your cranial nerves. The first one I'm going to check is cranial nerve number 1. I'm going to ask you to smell something. Tell me what it is.
Alcohol.
Okay, I'm going to check cranial nerve number 2. I'm going to ask you to tell me the time by the clock over there.
10:30.
I'm going to check cranial nerve number 3, 4, and 6. So I'm going to ask you to follow my pen with your eyes only. And I'm going to check your eyes to see how they react to light. Okay, they react evenly and they do accommodate. The next nerve I'm going to check is cranial nerve number 5. And I'm going to touch your face with something hard and something soft. I'm going to ask you to close your eyes. And when I touch you, you tell me what is hard, what is soft, okay?
Okay. Soft. Hard. Hard. Soft.
Okay, very good. The next one I'm going to do is cranial nerve number 7. And this is where I'm going to ask you to smile, frown, raise your eyebrows. Good. Cranial nerve number 7 is intact. Let me check that off. And I'm going to do cranial nerve number 8. So here I'm going to whisper something and you tell me what I said.
1, 2, 3. ABC.
Very good. Both ears are intact. I'm going to do cranial nerve number 9 and 10. And I'm going to ask you to open your mouth and say ah. While you're saying ah, I'm going to look at your uvula. And your uvula is midline. I didn't see any sores. Lift your tongue up for me. Your frenulum is midline. You got all your teeth. Your oral mucosa is nice and pink. And then I'm going to check cranial nerve. Cranial nerve number 11. I'm going to ask you to push up against resistance. Very good. I'm going to check cranial nerve number 12. Can you stick your tongue out for me? Okay, your tongue is midline, so that's normal as well. All right, while I'm here, I'm going to check your eyes. I'm looking for any excess drainage, and I'm checking for any redness. Put your eyes up, down, sideways. Okay. Up, down, sideways. Okay. Your sclera is white and both your conjunctivas are pink. I'm going to check your ear. I'm looking for any drainage, any skin tags. I'm pulling up and back so I can see your eardrum, your middle ear. And that looks very good. It's nice and pearly gray, no drainage. And let me check the other one. Very good. And I note that your hair, your ears and your face is the same color, so that's very good. I'm gonna check your nose. I'm checking for any excess drainage. I'm checking for dryness. So when I look up, I can see that your turbines are nice and pink, no dryness, and there's no deviated septum. Okay, so that's very good. I'm gonna check range of motion on your head. I'm gonna ask you to look up, look down, sideways, the other side. Do you feel any pain, any kind of resistance?
No pain, no resistance.
Okay. I'm gonna go ahead and I'm gonna listen to your lungs. You got 8 in the front and 10 in the back. Okay, so let me start. I'm listening for any adventitious breath sounds such as wheezing. And come to the back. Deep breath in, out. Okay. While I'm back here, I'm just going to go ahead and check for thoracic expansion. Take a deep breath for me. Okay, and when that happens, my arms do separate. I'm going to check in the front as well. Deep breath in. Okay, very good. I'm going to listen to your heart. I'm listening for any murmurs. I'm going to start from the aortic, the pulmonic, the tricuspid, the mitral, Erb's point, and the apical, which you listen to for 1 full minute. And while I'm doing that, I'm checking your radial pulses. They're nice and even at a +2. I'm going to check your brachial pulses. And while I'm here, I'm going to listen to your carotids. Nice and strong at a +2. Tilt your head back for me. And can you swallow? Okay. And I can see that your trachea is midline. Everything is normal right there. Okay, I'm going to go ahead and ask you to stand up so we can do some upper arm range of motion. I'm going to ask you to do abduction and then abduction. I'm going to look for pronator drift by having your hands out and down. And I'm going to ask you to
Come to shoulders.
and then shrug. Okay. Then I'm going to observe your gait while you're standing. Walk normal for me. Very good. Go back. Walk on your toe point and your heel. Okay, while you're standing, I'm just going to ask you to bend forward so I can check your spine. And I'm looking at her spine. I'm looking for any abnormal curvature. Her spine is nice and straight. So you can stand up. And we're going to go to the bed so I can check your abdomen. Okay, I'm looking at your abdomen, and what I'm looking for, I'm looking that it's flat. I'm looking for any lesions, any sores, and I'm looking for any abnormal masses that may show up. Okay. The next thing I'm going to do is I'm going to listen to your abdominal sounds, and I'm going to start in the right lower quadrant. And you have very good bowel sounds, and it's present in all 4 quadrants. I'm going to go ahead and I'm going to palpate your abdomen.
Okay.
And I'm looking for if you're going to experience any tenderness. I'm looking for masses.
No tenderness.
I'm going to go ahead and I'm going to check your pulses. I'm going to check your femoral pulse. Your dorsalis, your pedis, and your popliteal. And they all are +2. They're very strong. I'm going to come back and I'm going to percuss your abdomen. Looking for any solid areas that I may miss. And I'm palpating for your aorta to see if it's enlarged, and it's not. And your liver. Checking your liver. And I'm going to also check for your spleen. Okay, the spleen is non-palpable, which is good. I'm going to go ahead and do some range of motion on your lower extremity. I'm going to ask you to flex, and I'm going to pull down against resistance. Very good. Point your toe. I'm going to try and push up. Okay, can you bring this leg up? Turn it out. Turn it in. Down. The other leg. Up. Turn it in. Turn it out. And down. Did you feel any pain?
No pain.
Okay, well, thank you so much for participating.
Thank you.
You're welcome.